Hello everyone, welcome to my channel Ravi Study Physio. So in the series of pharmacology, we are studying a different topic which is cholinergic drugs or medicines. So the cholinergic drugs are the chemical that act at the same site as acetylcholine and thereby mimic its action. It means cholinergic drugs are similar action of the acetylcholine. It means their action is to be parasympathetic, so it will be dilation of the pupil or also increase GI motility and constriction of the pupil. So that kind of things cholinergic drug in our body. So there is a classification of cholinergic. So the ester of choline, the acetylcholine and methylocholine, carbachol and butanol, that kind of some choline medicine we are using for increasing the parasympathetic action in our body. Next is to be cholinomimetics alkaloids. So this kind of alkaloids increase alkaloid activity in our bodies. So there is two example like polycarpine mesocarine, and third is to be anticholinergic sterases esters. It means it is reversible action. It will be occurs in our body. It means it will be reverse action is to be parasympathetic as rather than it will be to parasympathetic. So there is some medicine like neostigmine and physiostigmine. There is two medicine where action in our body is to be the sympathetic action, like pupil dilation or decrease GI mortality. What is irreversible organophosphorus compound, like pharmacological action of acetylcholine? What is the medicinal or pharmacological action in our body of acetylcholine? Similar to be cholinomimetics. First is to be muscarinic action. It is to also classification of the cholinergic drug. So it resembles the action of alkaloid muscarine found in some mushrooms. So alkaloid action same is to be action in our body. So this kind of drugs are found in some kind of mushrooms. So we are taking mushrooms, so they will be activate the mesocrine action is to be increase parasympathetic action in our body. Like in heart, what will be occur mesocrine action in our heart? So action of acetylcholine is to be reduce the heart rate and force of contraction. It means if any person have increased heart rate, so on that time we will use mesocrine medicine on that time to reduce the heart rate on the patient. Next is to be blood vessel. So acetylcholine relax the vascular smooth and dilate the blood vessel of the skin and the mucous membrane. It means if a patient suffers from vasoconstriction or atherosclerosis of kind of disease, so there is vessels of these arteries constricted. So ultimately the blood volume is to be high heart rate. So the blood vessel is to be constricted. So on that time we are using the mesocrine medicine on the patient, so it will be decrease and relax the blood vessels, and also it will be affect the mucous membrane to relax them. Next is to be smooth muscle. So what the mesocrine action do the smooth muscle? So like acetylcholine increase the tone of all other smooth muscle like GIT, gastrointestinal tract. The tone of the peristalsis enhance the sphincter and relax. It means if any food or like any substance will be not move further in our intestine, so it will be increase the like peristalsis movement of the food. So in our GIT tract, it directly act to be sent further into the small intestine to large intestine easily, while in dilate the sphincter and relax mode on the relax mode without any painful action occurring in our body. Next is to be urinary bladder. So what mesocrine action occur in urinary bladder? So it destroys the contraction and trigeminal sphincter relax, promote voiding of urine. It means if the patient is suffering from urge incontinence or neurologically bladder, so there is like patient suffering from urge urine, but there is contraction of the sphincter of the urinary bladder, so the some amount of urine is released our body on that time. So the mesocrine drugs help to relax the bladder muscle to dilate them and decrease the swelling and inflammation on the urinary, so it will be directly excrete out the urine with different time. So that kind of action help in urinary bladder. Next is to be bronchial smooth muscle contract resulting in bronchospasm. It means the bronchioles muscle, it will be relaxed of the muscle. If there is any dilation, so it will be contract relax. So that kind of inhalation exhalation of the process will be relaxing mood happening in our bronchial muscle. Next is to be secretory glands. So acetylcholine enhance the secretion of all gland like salivary, lacrimal, etc. So it means if patient have like a person have not excrete out their saliva or like lacrimal like tears in their eyes, so we are using the mesocrine medicines like polycarpine mesocrine. So that will be like open the tears pupil glands or relax them, reduce swelling. So that will be directly, not directly, it will be release the tears very smoothly on the specific time, or also the saliva in 24 into 7 hour during the food, the food taking, or like any substance you are eating. Next is to be eyes. So acetylcholine bring about the constriction of pupil by contracting the circular muscle of the iris. It means the mesocrine action, it will be same as to be acetylcholine. So it will be constriction of the pupil by contracting of the circular muscle of the iris. So both of the action will be done by the mesocrine muscle. Next is to be mesocrine action is to be done. Now nicotinic action happen in our cholinergic drugs. So they resemble the action of alkaloid nicotine. So nicotine help to alkaloid action into the nicotine in our body. So neuromuscular junction. So nicotinic is directly act on the neuromuscular junction. So it is acetylcholine brings about the contraction of the skeletal muscle. It means if there is reflex arc present in our body, so there afferent fiber let it to be sent to the signal into the brain, and efferent fiber let down into the some signal into the skeletal muscle. If we are hot, so we move back our hand. So that kind of reflex arc or to the action in our body is to be neuromuscular junction present in our body. So uh, that kind of nicotinic action will be done by the neuromuscular junction into the skeletal muscle. Next is to be autonomic ganglia. Acetylcholine stimulate sympathetic and parasympathetic ganglia and adrenal medulla. So nicotinic action will be occur also in sympathetic action, like dilation, or like parasympathetic ganglia is to be dilation, constriction of the eyes, pupils, or like GI mortality, increase or decrease heart rate, or different kind of activity in sympathetic and parasympathetic into the body. If person is not able to do this kind of activity, so we are taking some kind of cholinergic drug, so that will be increase that activity in our body. Next is to be central nervous system. Acetylcholine is a neurotransmitter at a several site in the central nervous system. It means acetylcholine is symptomatic action occur in our body, like a different kind of reflex action, or different kind of body temperature, pH. So that different activity which time occur or not, or for the regulation releasing of the hormone, or the send the hormone in the different part or targeted organ, is to be controlled by central nervous system, or also the help of acetylcholine with the nicotinic action. Next is to be now indication. So which patient we have applying of the medicine of cholinergic drug. So it is mainly used to experimental study and has limited clinical values because of following reason. It means A is mesonoric action and B is nicotinic action. Both of them are not used indirectly. Is to be patient, is to be happen only on the like some in laboratory animals like hamsters or rabbit. So it is rapidly hydrolyzed by the pseudo-cloniosteresis. It means it will be directly hydrolyzed our muscle. It should be pseudo action happen in our body, so it will be increase the toxic material in our body, so patient will be die. Next is to be it spreads widely and diffuses the easily, and thus does not produce the selective pharmacological action. It means the worldwide is to be not accepted this medicine because it will be select some pharmacological distribution. It will be directly not directly, it will be indirectly, or sometimes it will be directly harmful effects shown in our body, so it will be not used in our directly experiment on the human beings. Next is to be it cannot be administered orally as it immediately hydrolyzed and degraded by the gastric enzyme. It means take one example like methylcholine. It is a medicine used for some sympathetic or parasympathetic action in our body. So methylcholine one medicine, it is not taken by orally. By why not? Because it will be directly hydrolyzed. It will be so the action into the mouth, or like hydrolyze into the mouth, so it will be directly not show the action on the targeted organ. So it will be doctor will be directly injected into the our intravenous route, so it will be directly sent into the systemic circulation, and action is to be shown on the body. That is the that method is not applying the oral route, so we are taking the intravenous or subcutaneous route is directly inserted into the systemic circulation, so it not so the first pass metabolism into the liver or liver irritation, mouth ulcers, or different kind of disadvantages occurring in our oral route. Next is to be methanocol is in use as, so there is one medicine is methanocol. So in the case of gastrospasis and postoperative abdominal distension, it means Methanolone is 5 or 10 mg tablets or 10 to 13 mg tablet. It is taken by 3 to 4 times in a day. Why? Because it's the gastroparesis. It means there is any gastric abnormal difficulties. So it will be directly taken by the 10 to 5 to 10 mg tablets by the oral route. It will that medicine is taken by the mouth, but methylcholine is directly not taken by the mouth or oral route. Is it is directly inserted into the intravenous route. So that is the indication of the cholinergic drug. Next is to be contraindication of the cholinergic drug. So what patient suffers, we are not doing the medicine on that patient. So like hyperthyroidism, it means the patient have suffering from the thyroid activities to be high and the swelling. So the choline ester may participate the cardiac arrhythmias. It means if patient is taking medicine of the cholinergic, so it will be the abnormal heart will be occur because it will be patient has to be like thyroid action is to be hyper, so patient will take the medicine, so the default action is to be shown by the in the response to the body will be occur. Next to be bronchial asthma. If patient is suffering from asthma, so choline ester may participate the bronchospasm. It means the bronchial muscle of the our lung is to be swollen if patient is to be take the cholinergic drugs. Next is to be peptic ulcer. So if patient is suffering from peptic ulcer, so the choline ester may increase the gastric acid secretion. It means during the ulcer situation on the patient, the gastric secretion is to be increased rapidly in our body. So on that time, if patient is taking the cholinergic drug, it to be enhance the cholinergic symptoms in our body. Next is to be myocardial infarction. Is patient is suffering from myocardial infarction is to what is to be? It means the decrease the blood flow reaching it out the target organ or brain or like yeah, it's the brain. So the choline ester may cause the hypotension and form of conduction block. It means the ester will be bound to the blood vessels or is to be infarct over there or so ischemia or like constriction of the blood vessels. So the blood flow is not going into the brain. So there is ischemia occur or also the patient is to be going to the brain death. So that kind of situation we are not using the mesocrine medicine on that patient. Next, so that is the cholinergic drug. Thank you.